Hi, this is Dr. Mike Van Thielen. This video is about cortisol. Cortisol may be a causative factor of fibrogenesis and also contribute to the many specific and non-specific symptoms of fibromyalgia. Cortisol is often called the stress hormone because of its connection to the stress response. However, cortisol is much more than just a hormone released during stress. Understanding cortisol and its effect on the body will help you balance your hormones and achieve good health. Cortisol is one of the steroid hormones and is made in the adrenal glands. Most cells within the body have cortisol receptors. Secretion of the hormone is controlled by the hypothalamus, the pituitary gland, and the adrenal gland, a combination of glands often referred to as the HPA axis. Because most bodily cells have cortisol receptors, it affects many different functions in the body. Cortisol can help control blood sugar levels, regulate metabolism, help reduce inflammation, and assist with memory formulation. It has a controlling effect on salt and water balance and helps control blood pressure. In women, cortisol also supports the developing fetus during pregnancy. These functions make cortisol a crucial hormone to protect overall health and well-being. The effects of low cortisol levels. Low cortisol levels can cause a condition known as primary adrenal insufficiency or Addison disease. While rare, primary adrenal insufficiency is an autoimmune disease that causes damage to the adrenal glands. Symptoms may start slowly, but they can be quite serious. Patients with primary adrenal insufficiency can experience fatigue, muscle loss, weight loss, mood swings, and changes to the skin. Cortisol also acts to calm any excess activity of the sympathetic nervous system. So often, when a person has low cortisol levels, they have high adrenaline, which results in physical burnout and emotional outbursts. Problems associated with high cortisol levels. Sometimes tumors on the pituitary or adrenal glands can contribute to a condition known as Cushing syndrome, which is characterized by high levels of cortisol in the blood. Individuals with Cushing syndrome will experience rapid weight gain in the face, abdomen, and chest. Often doctors will notice this because of the individual's slender arms and legs compared to the heavy weight in the core of the body. Cushing syndrome also causes a flushed face, high blood pressure, and changes in the skin. Osteoporosis and mood swings are also a factor considered with Cushing disease. High cholesterol levels can also contribute to changes in a woman's libido and menstrual cycle, even without the presence of Cushing disease. Anxiety and depression may also be linked to high cortisol levels. And of course, excess cortisol stimulates fibrogenesis. Excess fibrin in the muscles and tissues causes impaired blood flow, resulting in poor oxygenation. The patient may experience hypoxic pain in the soft tissues and secondary muscle fatigue and weakness. General signs and symptoms of excess cortisol include weight gain, mostly around the midsection and upper back, weight gain and rounding of the face, diabetes, acne, thinning skin, easy bruising, flushed face, slowed healing, muscle weakness, aches and pains, severe fatigue, irritability, difficulty concentrating, high blood pressure, headache, low libido, edema and water retention, being thirsty, osteopenia, and osteoporosis. Everyone has high cortisol from time to time. It's part of your body's natural response to threats of harm or danger. But having high cortisol levels over long periods of time can have detrimental effects on your health and well-being. Factors that increase cortisol production are stress, activity, certain emotions, low levels of melatonin, and low levels of growth hormone. Factors that decrease cortisol production are optimal levels of melatonin, optimal levels of growth hormone, reduced stress, and control over your emotions and feelings. So again, it's imperative to test for cortisol levels, and the best test is the 24-hour urine test. For more information on fibromyalgia and an easy-to-implement action plan to put fibromyalgia into remission, please visit my website, mikevantielen.com.